Have you ever seen someone brush off a fever, a pounding headache, or sudden body weakness and say, "I just need some rest"? That moment can feel ordinary, quiet, almost harmless. But in rare cases, that ordinary moment can be the beginning of something that moves with terrifying speed. Meningococcal disease is one of those illnesses people often do not recognize soon enough, because it can start like so many other common infections. A little fever, a little nausea, a little confusion. And that is exactly why it can be so dangerous. The biggest mistake is not always missing the signs completely. Sometimes it is seeing them, but waiting for the rash, waiting for the morning, waiting to see whether it gets better. But when this disease is involved, hours can matter more than people realize. If someone develops symptoms like a sudden high fever, severe headache, stiff neck, vomiting, unusual sleepiness, confusion, or seems to be getting worse very quickly, this is not the time to guess, search, or hope it passes. This is the time to act. In this video, we are going to walk through what you should do the moment you suspect meningococcal disease, which warning signs should never be ignored, why waiting for the classic symptoms can be a dangerous trap, and how to respond in a calm, practical, life-protecting way. Because sometimes the most powerful thing you can do for someone is not to stay calm and do nothing. It is to stay calm and move fast. The first and most important thing to understand is this. If you genuinely suspect meningococcal disease, do not wait to see whether it settles down on its own. Do not tell yourself you will check again in the morning. Do not assume that the absence of a rash means it is probably something mild. Meningococcal disease can begin with symptoms that feel deceptively ordinary, almost like the flu, and then worsen very quickly. The two most common forms are meningitis and bloodstream infection, and both can become life-threatening in a matter of hours. That is why official guidance stresses getting medical attention immediately if the symptoms fit the picture. The next step is knowing what warning signs should instantly raise your concern. Many people think only of a dramatic rash, but that can appear later, and sometimes symptoms do not arrive in a neat or predictable order. Possible warning signs include fever, a severe headache, a stiff neck, nausea, vomiting, confusion, unusual sleepiness, trouble waking up, sensitivity to light, seizures, or a person who simply seems to be getting much worse very fast. In some cases, there may also be a rash with red or purple spots, but waiting for that rash can be a dangerous mistake. NHS guidance is especially clear on this point. Symptoms can appear in any order, some may not appear at all, and you should not wait for all symptoms or for a rash to develop before seeking help. So what should you do in that moment? First, treat it as urgent. If the person is rapidly getting worse, difficult to wake, confused, collapsing, having a seizure, or showing signs of serious illness, call emergency services or go to the nearest emergency department immediately. If the symptoms are concerning but you are still uncertain, err on the side of urgent medical evaluation rather than staying home and watching. This is one of those situations where acting early is far safer than acting late. A healthcare team can assess whether this is meningococcal disease, another form of meningitis, sepsis, or something else entirely. But that evaluation needs to happen quickly. The second thing to do is describe the symptoms clearly and directly when you seek help. Do not minimize what you are seeing. Say exactly what is happening. High fever, severe headache, stiff neck, vomiting, confusion, very sleepy and hard to wake, or rash that is spreading. If the person has become worse over just a few hours, say that too, because rapid progression matters. A calm, precise description can help health professionals understand the urgency more quickly. This is not the moment to worry about sounding dramatic. It is the moment to communicate what you see as accurately as possible. Third, do not rely on home care while deciding whether to get help. Rest, fluids, fever medicine, and keeping an eye on it are not enough when meningococcal disease is a real possibility. Those steps may feel comforting, but they do not address the danger. CDC guidance emphasizes that prompt diagnosis and treatment are critical because severe complications and death can occur without fast medical care. In a hospital setting, doctors may begin treatment quickly when meningococcal disease is suspected. because early antibiotics are a key part of improving the chances of a better outcome. Fourth, understand why speed matters so much. Meningococcal disease is not simply dangerous because it is serious. It is dangerous because it can move fast while still looking vague at the start. A person may begin the day with what seems like a fever and fatigue, then become significantly more ill over a short period. With bloodstream infection, the bacteria can damage blood vessel walls and cause bleeding in the skin and organs. That is one reason this disease is treated with such urgency by public health authorities. The problem is not only what the symptoms are, the problem is how quickly the situation can change. Fifth, while help is being arranged, think about close contact. Meningococcal bacteria spread through close or lengthy contact, especially through respiratory and throat secretions, such as living closely together or sharing saliva. That means it is wise not to share drinks, utensils, toothbrushes, cigarettes, lip products, or anything else that can transfer saliva while you are awaiting urgent evaluation. This is not about creating fear around casual contact. It is simply a practical step to reduce unnecessary exposure until medical professionals can advise further. Sixth, if meningococcal disease is later confirmed, there is another important reason early medical evaluation matters. Close contacts may need preventive antibiotics. CDC guidance states that close contacts of someone with meningococcal disease should receive prophylaxis. Most viewers will never need to make that call themselves because public health and healthcare teams will guide the process. But it is helpful to know that seeking care early is not only about the sick person. It can also help protect the people around them. Another common mistake is focusing on only one classic symptom instead of the full picture. Some people tell themselves, there is no neck stiffness, so it cannot be meningitis, or there is no rash, so it cannot be meningococcal disease. That is exactly the kind of thinking that causes delay. Symptoms can vary, and in the early stage, the illness may still look incomplete. What matters is the overall pattern. A person with signs of severe infection, worsening fast, especially with fever, headache, vomiting, neck stiffness, confusion, extreme sleepiness, or rash, needs urgent medical attention. Trusting the pattern is often more important than waiting for a perfect checklist. It is also important to say this clearly. This video is not telling viewers to diagnose meningococcal disease at home. The goal is not self-diagnosis. The goal is fast recognition that something could be seriously wrong and that urgent care is needed. A healthcare professional must determine the cause, and meningitis symptoms can overlap with other serious illnesses too. But when the possible consequence is something that can turn critical in hours, the safest choice is immediate medical evaluation, not delay. So if you want one simple action plan to remember, make it this. Notice the warning signs. Do not wait for every symptom. Do not wait for a rash. Do not try to manage it at home and get urgent medical help right away. Those choices may feel small in the moment, but in a disease known for how quickly it can worsen, those first decisions can make all the difference. Now let me ask you something important. If there were no rash yet, would you still treat this as an emergency? That is where many people lose precious time. They wait for the one dramatic sign they have heard about, and in that waiting, the illness keeps moving. But official guidance warns that symptoms can appear in any order. Some may not appear at all, and in the early stage, there may not be a rash yet. That means the most dangerous moment is often the moment when a person still looks maybe okay to everyone around them, even as the condition is getting worse fast. So here's the pattern interrupt you need to remember. Do not wait for the perfect checklist. Do not wait for certainty. If someone has fever, severe headache, vomiting, stiff neck, confusion, unusual sleepiness, trouble waking up, or is rapidly deteriorating, trust the urgency of the situation and get medical help immediately. In fact, both CDC and NHS guidance emphasize immediate medical attention when meningococcal disease or meningitis is suspected because these infections can worsen in hours.